Hello and welcome, it's James from JL PhysioFit, and thanks for checking out my short video on the 4 most common causes of hip pain and how to overcome them. So by the end of this video, you're going to have a much better understanding of why your hip might hurt and what little strategies you can put in place to help start overcoming them. Now, given that you're here watching this video, you know that hip pain can be a horrible thing to deal with. Sometimes it catches you off guard with a sudden sharp pain, and other times it might be a nagging, dull, painful ache from the minute you wake up. Now, these painful flare-ups can often limit the amount of activity you can do due to pain, making life a struggle and actually forcing you to miss out on the things you enjoy the most. Well, if that's you, you're not alone. And hip pain is very common and something we deal with in clinic every day, and it affects people of all ages. The good news is that it can often be dealt with conservatively without any invasive measures like joint injections or surgeries. It also may come as a bit of a surprise to you, but sometimes what drives people into the clinic isn't actually pain in their hip, but a stiffness and soreness of their lower back. And it's only on assessment that we actually determine the root cause of their back pain is actually coming from a deficiency of their hip joint. So if you lack strength around the hip or you lack mobility, that can often track up, causing stress and strain through the lower back. So if you're struggling with hip pain, either in the crease of your groin or on the side of your hip, or pain that's deep in your buttock, which is sometimes associated with pain down the back of the leg, or you've got low back pain, then you're in the right place. Now, before I dive into 4 of the most common causes of hip pain, please keep in mind that everyone is individual. And what I'm going to talk about now is very, very generalized advice around hip pain. Obviously, you're going to want to get some professional help if you want a specific plan for your body. And if that's you, then simply give us a call on the number below and we'll be happy to chat about how we can best help you. Right, so let's get into it. Right, so the 4 most common causes of hip pain. So first of all, this is going to be a bit of a whistle-stop tour. Obviously, I don't want to keep you on too long, so I want it to be straight to the point. And obviously, if you've got any questions, you can drop me an email and I'll be quite happy to get back to you or have a chat on the phone. So the first part we're going to talk about is called lateral hip pain. So often when people come into the clinic and they point to the outside area of the hip being sore, we refer to this as lateral hip pain. So I'm just going to show you on this 3D model here. It's really good for getting a bit of a deeper look at what's going on under the skin. So if we just zoom in on this area here, this is the right hip here. And lateral hip pain can be split roughly into 2 main causes. There are other causes, but again, for the sake of time, we'll just talk about the main 2. And that is a bursitis and that is a tendinopathy, a gluteal tendinopathy. So the first one, which you may have heard of, is called a bursitis. And if we just remove this top layer here, so this is your gluteus maximus, and then you've got your gluteus minimus, and then underneath there, you've also got the gluteus medius. And those 3 are the main glute muscles, and they kind of all attach into the outside of this hip area here. So a bursitis is basically where we get an inflammation of a bursa. So a bursa is just a fluid-filled sac, which basically allows frictionless movement between structures, so tendons and ligaments and muscles. And the bursa would roughly be sitting here, and that bursa might be inflamed, which could be the source of pain. Now, the bursa could be inflamed for a number of reasons. It could be weakness in the muscle, it could be tightness in the muscles, and also it could be a direct fall onto the outside of that hip area, which has inflamed the bursa. Okay, so moving on, we've got a gluteal tendinopathy or tendonitis. So as you can see, this is the main muscle belly here, and then it attaches in via a tendon, into the bone here. Now, it's this tendon area that can often get inflamed or kind of starting to break down. And again, it's similar reasoning. So we can get tightness in the muscle, which is putting too much pressure on the tendon. We can get weakness in the muscle, so there's a little bit too much movement at different areas, which can then start to cause a little bit of disrepair in that tendon, and they can all lead to pain. And we can get tendonitis in either one of these tendons here, so it could be the glute med, which sits underneath. Yeah, it could be that this muscle is really the one we need to help focus the rehab on. But either way, it's often the same kind of exercises and regimen that we would put in to a glute tendonitis, regardless of which one it actually is. So that one is lateral hip pain. So if we move on to number 2 now, and you may have heard of this before, but this is called piriformis syndrome. So if we stick with this kind of a few layers off the actual hip, we've got the piriformis, which is here. So your piriformis basically comes from the inside of that sacrum here, which is your sacral bone, and it attaches again into the top of that outer hip bone there. And you can feel that on the side of your hip if you press your fingers into it. So this muscle here sometimes can get irritated through a number of reasons. So if, like I was saying before, if the glute muscles aren't performing jobs that they're supposed to because either there's some weakness there or we've got some pain in other areas, so then they start to compensate and they tighten, then the piriformis can then come under too much load. And the piriformis is quite a unique muscle because the sciatic nerve, which is the main nerve which kind of feeds the muscles on the back side of your leg, actually comes out from the lower back. I'll just draw it on here. So the sciatic nerve roughly comes out of, L4, L5, S1, which is the lower part of the lumbar spine. And then it kind of comes down here, and then in some people, it will actually go through this muscle, but in most people, it just goes either behind the muscle or in front of the muscle. So due to its location, if the piriformis gets overworked and tight, then it can start to put a bit of a pinch on this sciatic nerve here, which can then start to cause pain down the leg, even down into the calf and into the foot. So that's kind of piriformis pain there with sciatic nerve involvement. Again, if we're going to determine if it's the piriformis muscle at fault, we have to perform a really good assessment to work out, is it actually coming from an irritation or structure in the back which is causing the pain, or is it just this muscle which is actually causing that pinch on the sciatic nerve? So that's kind of piriformis syndrome. And now let's have a look at the other two. So the first one I'm going to talk about is called an FAI. So an FAI is ephemeroacetabular impingement. And put simply, that refers to, I'm just going to remove these layers here so we can actually get down and see the main hip joint. It's quite an amazing model, this. So it won't let me go any lower than that. So basically, an impingement is where the front part of this hip, so the hip joint itself is a ball and socket joint. So we've got the neck of the femur here, which is your thigh bone, and then it's got this ball on it, and it fits into this acetabulum here, and that's the hip socket. So an impingement sometimes happens when the front of this hip bone here gets pulled forward slightly and starts to irritate. I'm just going to draw on here. Starts to irritate the front of this labrum or this socket here, and you can often get a painful sensation there. So people who are suffering with this FAI will often come in and they'll kind of point to the crease of their groin. They might get pain when they're bending down to put their socks on. They might get pain when they're lifting the knee up to the chest because they're getting too much compression through there. Now, often, again, after a full detailed assessment, what we might find is that we have an imbalance between our hip flexor muscles and our gluteal muscles, which is causing a bit of an imbalance at the hip joint itself. So the hip flexor muscles, briefly, one of them is here, and this is your iliacus. And then let's just add a layer here. And then this is your psoas. So combined, the iliopsoas, they form that main hip flexor muscle. Now, often because people spend a lot of time at a desk all day, these muscles can get quite inhibited. So they're really tight, just sheerly because you're sat in a shortened position. Now, these muscles work in conjunction with the gluteal muscles at the back. And the best example I can give is if you bend, so think of a bicep curl. So if you were to flex your bicep, your tricep would switch off to allow you to move that piece of bone towards the bone. If the hip flexor muscle is chronically switched on and very tight, the gluteal muscle is slightly switched off. And switched off is inhibited is a better word, because obviously you've still got drive to that area. There just becomes an imbalance, and the net result is the hip joint gets inflamed through here. So that is the third common cause of hip pain. And then lastly, we've got osteoarthritis. So this tends to be in people who are a little bit old. So kind of age-related changes, I guess, often are described with hip OA, but it can come on in younger populations. And essentially, if we were able to kind of zoom in, let's have a look. Yeah, we kind of can. So above the head of, so this socket here, yeah, is holding the head of the femur, and the head of the femur and the socket both have cartilage. And a cartilage is kind of a shiny substance which allows a little bit of compression and allows the bones to kind of glide within the joint. Now, often through wear and tear or through excessive use of joints, maybe poor muscle imbalances, we can get too much pressure, and over time that starts to break this cartilage down, which then causes something called osteophytes. And an osteophyte is just a bony growth which I'm just going to draw this on here, which, so when your brain detects this problem, it tries to repair the cartilage, and you get these osteophytes growing here within the joint, which then as a result basically limit some of the movement you get in there, and also can cause pain. So that's hip OA. Again, if you've got hip OA, it doesn't mean you need to go for an injection or surgery. There's often a lot of conservative measures that we can do to help improve some of that pain and kind of slow the rate of deterioration down. It all comes down to, again, a really good assessment and a specific plan for you. So those are the 4 most common causes of hip pain. I hope you found it useful. If you want to talk to us a little bit more, if you feel like you've got some of these problems and you want them looked at, then just give us a call and we'll be happy to discuss. So I hope you found that useful. Thanks for watching.